I know the trainees certainly wish they had a chance to be with their families and their friends at today's swearing-in ceremony. I'm glad their friends and their relatives were at least able to watch live stream from home. I also want to thank the Kraft family for accommodating the swearing-in here today. These new troopers will join the force during truly unprecedented times. As I told them during the swearing-in, I'm incredibly grateful for their decision to step up and serve the people of our Commonwealth. They've answered the call just like so many others who are working together to push back against this virus. With respect to testing, yesterday over 9,000 tests were reported across the state. That brings our total number of tests conducted to over 333,000, continues to make us one of the top per capita testers in the country. And about 13% of those tests reported that came back yesterday came back positive. Over the past week or so, the percentage of positive cases has consistently been lower than it was last month. As a point of reference, in mid-April, around 30% of our COVID-19 tests were coming back positive for the virus. We're encouraged by this data, but it's important to remember that test results alone are not telling the whole story on how COVID-19 is still brutally impacting many of our communities. Test results obviously are dependent to some extent on who gets tested, and we continue to target areas of testing to certain facilities, including long-term care and high-risk and vulnerable portions of our population, as well as certain hotspots based on our conversations with our colleagues in the healthcare community. Every day, as you know, we talk to our colleagues in the healthcare and the hospital community to monitor hospital capacity and hospitalization rates. As of yesterday, there were 3,542 patients, or about 5% of the cases of COVID-19 in Massachusetts, based on our testing results, were hospitalized due to COVID-19. That number has basically been flat for the past several days. As I said yesterday, we're also encouraged by the trend associated with hospitalizations. We're still very much in this fight with COVID-19, but it is encouraging to see some positive progress. As we come through the other side of this and determine our next steps for a path forward, we need to see those numbers continue to drop. Our goal, starting on May 18, is to begin reopening certain types of businesses in a limited fashion, where it can be done more safely than under normal operations. But this phased-in process can't begin until we see sustained downward trends in many of the data elements that we talk about every day. The data we're looking at includes several factors, such as positive test rates, hospitalization rates, and fatalities. Another critical data point we're monitoring is the number of hospitals that are treating patients under so-called surge conditions. What that means is that several weeks ago, when we canceled elective surgeries, we worked with our healthcare providers to add more beds and more staff to the system to cope with the increase in COVID-19 patients. This was done in several ways, as we've already discussed. Field hospitals were set up, wings of some hospitals that were dormant were brought back online, and healthcare providers actually converted parts of their facilities to treat COVID-19 and ICU patients. Right now, a significant number of hospitals are still very much relying on these temporary spaces and beds. We need to have more and more patients recovering and moving out of hospital-level care so that hospitals can return to what we would describe as a more normal level of activity. The phased reopening, where only certain industries begin to reopen that we're planning for now, can't move forward until we see progress on surge capacity among some of those other elements. And as I said, the virus is still very much challenging our healthcare system and in many cases impacting our communities. Right now, we have to continue the hard work of slowing down and pushing back on the virus. Today's also the first day that our executive order on face coverings is in effect. As infectious disease specialists continue to learn more about COVID-19, it's clear this virus is highly contagious and can be spread from person to person without symptoms. I want to repeat that. This virus can be spread from person to person without symptoms. It's possible for someone to carry the virus, to be infected, and to infect others without knowing that they are actually infected with COVID-19 themselves. Effective today, that order that I signed, requiring residents to use a face covering in public places, when they can't social distance from others takes effect. Children under the age of 2 should not wear face coverings, and neither should people who are unable to wear a face covering due to a medical condition or another DPH exemption. There are many businesses in Massachusetts and many communities that have already issued similar policies for their employees, for their customers, and for their constituents. This requirement in Massachusetts under our order applies to all workers and customers of businesses and other organizations that are open to the public. Face coverings will be expected at all times in grocery stores, retail stores, and on public transportation. And with respect to that one, I just have to say that since we issued the advisory and since we issued the order, we have heard time and time again from people who work in the public transportation system, people who work in pharmacies, people who work in grocery stores, and people who face customers as essential businesses during this pandemic have thanked us time and time again for putting mechanisms in place to ensure the safety not just of their customers, but also of themselves and their families, because that face mask worn by both people is one of the primary ways we can stop the spread of COVID-19 from one person to another. As many people know, face coverings can be made from several items that you currently have in your wardrobe, like a t-shirt or a scarf or a bandana or other breathable fabric. You can also use disposable masks. One thing we would make clear is that residents should avoid using medical-grade masks. We do need to prioritize those for healthcare workers, first responders, emergency management personnel, and public safety people. The Department of Public Health has posted more information on what you can use for a face covering at mass.gov/COVID-19. We view this as a common sense way to set a statewide standard for the long term as we look to get back to a new normal. And we're working around the clock with our frontline workers and others to support those who continue to serve us every single day throughout this crisis. That includes distributing personal protective equipment to healthcare entities and first responder agencies. As of yesterday, we've delivered over 8.5 million pieces of PPE, including masks, gowns, gloves, and ventilators to these organizations, and will continue to take the steps we deem necessary to sustain our response against the virus. We are cautiously optimistic about some of this data, but we should certainly not let up now. And as I stand here with Gillette Stadium behind me, I have to say that no one quits, no one stops, no one slows down in the fourth quarter. Thanks very much. And again, I appreciate all the support and the commitment that the people of Massachusetts have brought to this fight. Thank you. Well, two of the things we did with the executive order was, number one, we gave store operators and store owners the authorization to make a decision about how they want to handle this if customers aren't wearing face coverings. And they can do that through a variety of means and mechanisms. And we also gave our colleagues in local government the ability, if they see people not doing the right thing, to execute on that as well. And we gave them the ability up to a certain level to issue both warnings and fines. It's my hope and my expectation that that won't be necessary. I can tell you that many of the communities that have issued similar guidance or advisories or orders to the ones that we've issued have said that for the most part they've issued a few warnings. Almost nobody's issued a fine. But the big thing they've said over and over again is you have to communicate why it's important. You have to put signage up so that people know and recognize where it's expected, and that people, for the most part, comply, which is what you would expect. So, first of all, with respect to the trends are what they are, and I've said many times that coronavirus, COVID-19, is a novel virus, and therefore we don't have a lot of history about how it works or what path it will choose to take, and therefore it's very it's very risky to make broad prognostications about what's going on, where it's going, how it's going to get there. So much of what we know about this virus has changed in the last 60 days. Some people might even say that everything we know about this virus has changed in the last 60 days. So when I say here that we have seen encouraging trends, that's because I'm talking about the past. I'm not going to speak to the future. The future is going to be what it's going to be. What I will say is that if people continue to do the things they've been doing so well for the course of the past 60 days, as difficult as those things are, we have seen a significant reduction in what people originally thought both the level of hospitalization was going to look like, the level of ICU service requirements was going to look like, and the number of people who were going to pass away was going to look like. And that is purely attributable to the work that people in Massachusetts have done to slow the spread. And that I can speak directly and definitively to. The stuff going forward is going to be what it's going to be, but people need to keep doing the things that got us to this point if we want to see that downward trend continue. So we've been looking at, first of all, some folks came in and did talk to the advisory board. I think that was a good meeting. And we've been talking to our colleagues around the Northeast region about what their policies and practices are, and are incorporating that into our decision making as well. Let's hope and anticipate that people don't start breaking the law. That would be a bad thing. I'm not going to speak to hypotheticals on stuff like that. I never do.
Governor, you said the numbers are flat.
This is a virus that has never been around previously, and I wish it was something like, I wish it was a virus that we had lots of knowledge and lots of information and lots of historical experience with that we can incorporate into the way we think about it and the way we predict where it's going to go and how it's going to act. It's not, and I don't think I would refer where we are now on terms of sort of a second plateau or what's going to happen going forward. What I would say is that, generally speaking, the trends over the course of the last 6 to 8 days have been reasonably positive. But I think creating real clarity over where you think this is all going to go or what this means where we are today, I don't think this is the sort of circumstance or situation where that's going to be particularly helpful. I think the right way to think about it is if people distance and people do the things that they've been doing, we will hopefully continue to see some of the progress we've seen over the course of the past 20 or 30 days. I mean, I can't speak enough to the fact that if you go back to where people thought we were going to be in Massachusetts in March, when a lot of the very difficult decisions were made and people began implementing them, we're in a completely different place. Such a different place that people say all the time, well, the models were all wrong. Well, yeah, the models were all wrong because everybody changed the way they live their lives, and by making those decisions, they totally changed the impact of the virus on the Commonwealth and on the healthcare system. And that is the one thing I can say is absolutely positively true. But when people start saying, you know, is it going to go here, is it going to go there? It's not something we have history with, which makes drawing big conclusions about it, as I said before, just not very helpful.
Governor, is the advisory board working on how much notice that people can have about this phase of reopening? I mean, will it be 3 days, 5 days, 7?
They're planning to make what I would describe as interim reports along the way here between now and the 18th, absolutely. They have made several. I think you'll likely see some decisions made over the course of the next several days, if in fact the trends we've seen so far continue with respect to some of that ancillary capacity that we developed. Yeah.
Governor, some are asking why let state police will provide graduation ceremony when high schools
Yeah.
can't do that.
So we are in desperate need of more state police troopers on the roads, supporting our communities here in Massachusetts. This is the largest class of academy graduates in 25 years, and frankly, it's almost twice the size of the typical class. And we need every single one of those people to be out there working. And they can't get out there and work until they get sworn in. And I appreciate I had mixed feelings about whether or not it made sense to do something like this, but I needed to swear them in before they could actually go to work, and I need them to go to work. And this was deemed as a way to accomplish both of those objectives as quickly as we possibly could. If we tried to do this in small gatherings over the course of many days, we would lose time that would otherwise be available for us to get them to work. We need them out there. And I say that recognizing and appreciating that for a lot of other people, the gathering rule is an enormous impediment to many of the rituals of daily life. I get that.
Last question.
This is graduation, graduation season. What do you say to the high schoolers, those in college who may not get, this is different from what normally is.
Yeah, I mean, there was no family here. There were no friends. It was just an empty place. Look, I may be a public official, but I'm also a neighbor and a friend of a lot of people in the town I live in who have kids who are graduating from high school. And I certainly have, my youngest graduated from college last year, so I still know a ton of folks who have kids who are graduating from college this year. And I've done a bunch of remote attaboy, attagirl congratulation type stuff for schools that are holding virtual graduations of one kind or another. And I'm going to continue to do those because I do believe these are important moments and they ought to be recognized. But I think the big message I would send is I graduated from high school 45 years ago, and I graduated from college 41 years ago. What I really remember, and I say this when I actually give commencement addresses, what I say when I think about this is it's not as important as that moment may be. What I really remember mostly about all of that are the experiences and the friendships and the learning and the relationships I had with professors and teachers and all the rest that came with the experience. The sports that I played, the teammates I had, that's the stuff over time that ultimately sticks. And I am more than well aware of the importance of the ritual and the ceremony and the opportunity to cap off a high school or a college career. And it kills me that all these kids who were planning to rely on this spring season in many cases to sort of round out their athletic career or their academic career or participate in the last school play they were going to get to do or play in a band or whatever it might be. And not being able to do all those things is just grim and unfortunate. But the flip side of that is we are now talking about good news over the course of the past week or so with respect to dealing with a virus that would have expected to be in a much different place if we hadn't made the decision we made to not do a lot of this stuff. And I've never said I felt like we were making good choices. I thought what we were making were the least worst ones. And that's been true in many respects on a lot of things. And all these issues associated with graduations and gatherings and spring sports and all the rest they're part of the package.
Should high schools be saying, hey, let's do this
I certainly think I know there are conversations going on to try and figure out some way to appropriately recognize and congratulate kids associated with this stuff. Yeah.